The complete registry dataset result that recently published in the Stroke Journal is very important to the field. It shows that use of the Penumbra system, the engine aspiration system, the Jet 7, the A68, the Jet D are very effective across all users, all hospital experiences. So now this is a real world experience. Some people may say aspiration is excellent in my hand, but not in the other people's hand. Now we have shown and demonstrated across all users it's as effective. For example, the revascularization to TICI 2B to 3 at the end of the procedure across all the 650 patients was close to 88%. If you look in particular to the posterior circulation was 92%. The rate of the first pass effect close to 30% in the anterior circulation and almost 56%, which is the highest in the literature in the posterior circulation. Moreover, the functional clinical outcome and independent achievement at 90 days, at 3 months, was close to 56% across all the patient population. This is not on the expense of the safety outcome. As you could see in that paper that was published in the Stroke Journal, the mortality rate was 15% and almost less in those with aspect score of 6 and higher at 14% mortality rate at 90 days, and the rate of symptomatic hemorrhage was very low at 3% at 24 hours, and the rate of the embolization into the new area was only 2.8%. Overall, these are excellent results in real life in a large sample size of 650 patients. The result of this complete registry is really very, very well received by the field. One, because it really shows that using the Penumbra system as a frontline treatment is very effective across all users, all experience, and across all hospital centers, regardless whether they are a comprehensive stroke center or a thrombectomy ready center or not. So this shows that the wide use of the Penumbra system was effective and efficient across different user and different hospital. For example, the result of the revascularization and recanalization at the end of the procedure was close to 88% in the anterior circulation and 92% in the posterior circulation and the basilar occlusion clot. The result of the modified Rankin scale, the functional outcome, the independence at 90 days was close to 56% across all occlusion site. Again at 3 months. So those are the key results. In addition, if you look at the safety result, the mortality was very low in the anterior circulation with a good aspect. It's about only 14% in comparison to a historical control in this population. And the rate of hemorrhage at 24 hours, that's symptomatic, was only 3%. And the rate of distal embolization and embolization into new area was 2.8%. The treatment algorithm across many centers and many hospitals and many interventionalists may change based on the complete registry data set results. If you think about it, we have a hard time to decide what frontline treatment we should go to. Luckily, we have many treatment options in our toolbox. The Penumbra system is one of them. In my opinion, something that quickly stands out at you, that in those patients, 15 to 20% that comes with a posterior circulation, large vessel occlusion, ischemic stroke, are the best candidate to start with a frontline Penumbra system as a treatment of choice. With 92% recanalization rate, it's also phenomenal first pass effect rate of 56%, which is kind of like the highest reported in a core lab adjudicated data in the literature. So with this very high rate of complete recanalization or successful recanalization at 92% and a first pass effect the highest in the literature by a core lab, I would think this is the very easy target to go to with the Penumbra system immediately as a treatment of choice, frontline treatment. In addition, the rate of good clinical outcome in the anterior circulation and the rate of revascularization of 88% using Penumbra system make you more confident for cost-effective to start with the Penumbra system as your first choice in this population as well. So I think, as you can see, you can't really say that one approach is more superior than the other, currently, though we don't have a control data, but at least we know from our single arm prospective registry using Penumbra system, we achieved good result for both anterior and posterior circulation. But I think the posterior circulation, very few people would argue that going with the Penumbra aspiration system is the way to go. Mechanical thrombectomy worldwide in 2022 have a really significant importance in taking care of large vessel occlusion, acute ischemic stroke worldwide, globally. It's really changed the stigma about a stroke by the ability to cure it, reverse the disability, and make patient do well and much better with functional outcome at 90 days. If you look at the aspiration system worldwide, in general, it provides an opportunity for fast, effective treatment and cost effective in many countries worldwide that may not be able to afford all the combination therapy, all the devices in the tool set. Using an aspiration first approach, provide for those patients effective, cost effective therapy that lead to a better functional outcome and that lead to a very successful revascularization rate.